Unit 10, Module 5 is about promoting safety for the older adult patient. The reading for this module is from your T&J book, chapters 15 and 16. These 7 sub-competencies focus on understanding how health, environment, transportation, community support, and assistive technologies influence safety and independence in older adults, and on applying the nursing process to address these concerns. First, let's talk about factors that influence an older adult's perception of safety as they age. So first is their declining physical health. This significantly impacts an older adult's safety perception and their actual level of risk. So as their physical health weakens, tasks that were once simple begin to feel more challenging, and this can make someone feel less secure moving around or completing daily activities. Then there are changes in the visual or auditory acuity. As their vision and hearing decline, it becomes harder to detect hazards like hearing alarms or seeing obstacles clearly. So these sensory changes can greatly affect their confidence because the environment may longer feel predictable or safe to them. There are mobility changes which cause reduced strength, balance issues, slower reaction times, which can all contribute to an increased fall risk. When their mobility declines, people often become more cautious or anxious about navigating their surroundings. A loss of a spouse or caregiver is another significant factor. When someone loses their primary source of support, both emotional and physical, their sense of safety can shift dramatically. So this loss can leave the person feeling more vulnerable at home and in public spaces. And lastly, environmental changes such as downsizing can be an effect on their safety perception. So moving to a smaller or unfamiliar home can disrupt their routines and, of course, from their familiarity. So new layouts, different lighting, rearranged furniture can make someone feel less secure until they have adjusted. So even when downsizing is necessary, it can temporarily increase their safety concerns because the environment no longer feels predictable. So overall, these age-related changes collectively influence how safe an older adult perceives themselves to be, and they also impact their actual level of risk. Now let's talk about fall risk in older adults in the home setting. This is a major safety concern. So falls are often led to serious injuries, including traumatic brain injury. This is especially dangerous for older adults taking anticoagulants because even a minor fall can result in significant bleeding. Fall risk is usually complex and comes from a combination of chronic conditions, acute illness, cognitive changes, psychological factors, and lifestyle. So some of the main contributors include gait and balance impairment, age-related weakness, and sensory deficits such as decreased vision or hearing. So polypharmacy is also a major factor. When someone is taking 4 or more medications, the risk of dizziness, confusion, and instability increases. Environmental hazards and medical illness add to this risk, and cognitive impairment can affect judgment and reaction time. For people with a fear of falling, this can lead to a cycle that leads to decreased activity, muscle loss, and even greater fall risk. So to assess the fall risk in outpatient settings, the timed up and go test is commonly used. So this involves a person standing from a chair, walking 3 meters, turning around and returning to the chair to sit down while the clinician will time this task. Slower tasks suggest a decreased mobility and higher fall risk. So usually they time it about 15 seconds, and anything up beyond that would definitely indicate concern. So that's generally the time frame. In the inpatient settings, we've heard about the Johns Hopkins fall risk and the Morse fall scale. So the timed up and go test, or the TUG test, is more for individuals that live at home still. So overall, preventing falls means understanding these contributing factors, recognizing how physical, cognitive, and environmental issues interact, and using validated tools to guide safe nursing care. Older adults are especially vulnerable to temperature extremes, including both hypothermia and hyperthermia. Several factors contribute to this vulnerability, starting with thermoregulation changes that occur with age. Age-related neurosensory changes reduce awareness of temperature shifts. So this is why an older person might wear a sweater even when it's 90 degrees outside, or they fail to recognize when their home is too cold. So a temperature around like 60, 62 degrees may already be unsuitable for many older adults because their thermoregulation is altered. Medications do play a major role. So many drugs can vasoconstrict or vasodilate or inhibit neuromuscular activity. So all of these can create or worsen heat or cold stress. So on top of this, chronic illnesses increase the risk of temperature-related injuries. So conditions like obesity, cardiovascular disease, respiratory disease, and even diabetes all make older adults more susceptible. So for example, someone with a history of diabetes type 2, diabetes mellitus, is at higher risk for hypothermia in cold environments. So we also consider physical, cognitive, social, economic, and environmental factors. So such as limited mobility or reduced income, housing that is poorly insulated can all make older adults more vulnerable. If a patient is discharged home and becomes confused, one of the first things a home care nurse should check is the household temperature in extreme weathers. Another important point is that up to 1/3 of older adults with acute infections may not present with a fever at all. So their bodies don't always present a febrile response. So careful monitoring is essential. So still, it's important that the nurse continuously monitors their temperature. Overall, all of these factors together increase the danger of temperature extremes for older adults, making prevention and monitoring a critical part of their care. Older adults are especially vulnerable during natural disasters for several reasons. Those at highest risk tend to have limited mobility. They rely on electricity, for example, for their medical devices, live alone, they're sometimes socially isolated, they have cognitive impairments, or also they may live in institutional settings. So these are all older adults who are most vulnerable during natural disasters. All of these factors make it harder for them to respond quickly or safely during an emergency. They're less likely to sometimes, or they're unable to seek formal or informal help, which increases danger during events like heat waves, power outages, winter storms, or evacuations. Because of this, it's important to connect older adults with resources that can support them. So this includes home care nurses, public health, or community outreach workers. FEMA, which is the Federal Emergency Management Agency. There's the National Weather Service, the American Red Cross, and the U.S. Department of Health and Human Services. So these agencies can actually help with preparedness, alerts, evacuation support, and recovery assistance. Driving is strongly tied to independence for many older adults. However, age-related changes can make safety a big concern. Nurses should assess access to transportation, address driving issues early, and refer families to social service and aging organizations for support or financial assistance with alternative transportation. Resources for formal driving evaluations are limited, costly, and usually not covered by insurance. So this really highlights the need for more research in this area. It is associated with more positive outcomes for the driver to voluntarily give up their driver's license versus being forced into having their license revoked. So barrier-free buses and low-fare transit options can promote independence, but this may not be safe or realistic for adults with mobility or cognitive limitations. So nurses must evaluate individual abilities before recommending any type of public transport. Driving safety should be balanced with the need for autonomy, and for those who do continue driving, there are simple adaptations that can make a big difference. So these include wider rear view mirrors for better visibility, pedal extensions for those who have difficulty reaching the pedals, larger, simpler to read instrument panels. Front and rear electronic detectors help with distance and lane drift. There's left turn assist technology, which improves intersection safety. There's improved door protection, which adds an extra layer of safety. Booster cushions if shorter drivers aren't able to see well, so it helps maintain a proper line of sight. There's smart driving assistance and also GPS devices, which can support navigation and reduce driving stress. Assistive technologies are designed to enhance safety, security, self-care, and independence for older adults at home. So we'll talk about two major categories. There's telehealth and smart homes. So telehealth, which is depicted in this image, involves using electronic technology for clinicians to diagnose, monitor, and manage an adult patient's care remotely. Telehealth decreases the cost significantly by reducing hospital readmissions because it allows more early identification of problems before they become serious. It also promotes patient self-awareness since older adults become more involved in tracking their symptoms, medications, and overall health. So studies consistently show improved patient outcomes, fewer readmissions, and lower healthcare costs when telehealth is used effectively. On the right, we see a list of smart homes and smart home technologies. These all enhance safety by using environmental control systems, sensors, and monitors to collect information such as vital signs, gait, sleep, behavior, and activity patterns. Continuous monitoring helps with early detection and even prevention of health issues because subtle changes can be identified much sooner. So some examples we have motion pressure sensors. So it detects movement throughout the home, including getting out of bed, entering or leaving the home, or periods of inactivity. They can identify falls, wandering, or potential emergencies. Smart carpets have built-in pressure sensors that detect gait changes, balance issues, or unusual walking patterns, which can warn caregivers of increasing fall risk. The iShoe is a smart insole that monitors balance and foot pressure, so it can detect early signs of neuropathy, instability, or other problems before a fall occurs. There's smart soles, which they're similar to iShoes, but it has added GPS tracking in case individuals with cognitive impairment wander. So it provides safety and location monitoring. Others include automated medical alert devices. These notify caregivers or emergency responders when help is needed. And again, there's others that monitor vital signs or sleep quality, and even daily routines using AI to identify early signs of decline. Those are just some examples. So one important point is that smart homes enhance safety and independence, but they do not replace clinical judgment. So they collect data and support monitoring, but they don't act as interactive medical advisors. So together, though, with telehealth and smart home technologies, these are both representative of powerful assistive tools that help the older adults remain safe, supported, and independent in their own homes. Aging in place refers to the ability of older adults to continue living in their own homes and communities safely, comfortably, as well as independently. So this goal is strongly supported by elder-friendly communities. So elder-friendly communities are designed to promote well-being and optimize health as individuals age. The idea is not just to help people remain at home, but to ensure they can thrive at home. So they often include retirement communities and have several key components that make aging in place possible. So first, they help address basic needs, including affordable and appropriate housing, access to food, and safe environments. They also work to optimize physical and mental health and well-being, offering programs such as health promotion activities, fitness classes, wellness screenings, and access to healthcare. Another important component is social and civic participation opportunities. So community centers, group activities, volunteer programs, and social events that can help older adults stay connected and engaged. Finally, these elder-friendly communities maximize independence by providing accessible transportation, home support services, and environments that help older adults function at their highest level. Overall, aging in place is most successful when communities are intentionally designed or adapted to support the needs, health, and independence of older adults. The nursing process is essential when caring for older adults with safety concerns because it guides both our assessment and our planning of interventions. We'll begin with nursing diagnoses commonly seen in older adults. This includes ineffective community coping, social isolation, impaired home maintenance, risk for injury, hyperthermia or hypothermia, and risk for imbalanced body temperature. These diagnoses reflect the wide range of physical, social, and environmental factors that can compromise safety in later life. Assessment is a very important first step. For example, as we discuss, an older adult who was previously oriented and becomes suddenly disoriented and confused at home after discharge is concerning, especially, for example, the home care nurse should assess the temperature in extreme weathers. So temperature changes, especially in someone with chronic illnesses like diabetes mellitus, can increase the risk for hypothermia or even hyperthermia. So recognizing this is a very important step in the assessment phase. When we move to planning interventions, environmental safety plays a major role. So for fall prevention, some interventions includes lowering the bed, using fluorescent lamps or soft lighting, removing throw rugs, that's a big one, and using wall-to-wall carpeting instead of small throw rugs that can cause someone to trip and fall. It's also important to note that restraints are not recommended as an intervention at home to prevent falls in the older adults. Inpatient as well, if restraints can or should not be used, then we definitely want to avoid that if possible. So evidence shows that restraints can actually increase injury rather than reducing it. So by using the nursing process to guide our assessment, diagnosis, and intervention, we can create safer environments and promote better outcomes for older adults.